Okay, perfect. So hi, I'm Suzanne Spinola. So I'm the webinar coordinator for the Veterans Affairs section of Division 18, Psychologist and Public Service. I want to welcome you to today's webinar, which is ADKAR Framework in Psychology, Changing in Organizations and Change in People. So all questions can be entered into the Q&A box, and we will take time at the end to answer them. If there are any technical difficulties, please let me know in the chat box and I'll attend to you as soon as possible. So now let me introduce our speakers. So we have Dr. Marcia Hunt, is a clinical psychologist and serves as a quality improvement and implementation consultant in the Office of Mental Health and Suicide Prevention. And Dr. Theresa Schmitz is a clinical psychologist and serves as a national mental health quality improvement and implementation consultant in the Office of Mental Health and Suicide Prevention. Dr. Schmitz is also the national lead for the Family Services and the Office of Mental Health and Suicide Prevention. So without further ado, I will let them take it away.
Thanks so much, Dr. Spinola. Good morning or afternoon, everybody. We're really happy to talk to you today about our experiences as psychologists, learning and working with the ADKAR Change Management Framework, and how that aligns with our understanding of change in individuals. Next slide. Thanks. So I'm going to start by providing a brief history of a sort of change management and the many paths that have been developed. First, a definition. Change management is a structured approach to implementing change in an organization. And you'll see as this unfolds that this really parallels the individual change and behavioral change theory. So some history. One early model was developed by Lewin, and it articulates 3 stages of change. Unfreezing, which is preparing for change and unbalancing the system. Change, which is resolving the unbalancing and helping people believe in the new process or direction. And then refreezing, which is finalizing the stabilization and internalizing or institutionalizing that change. The interesting thing is, and you'll see that this kind of translates through a lot of other of the models, but Lewin was a physicist and a social scientist. And so he used this analogy of changing the shape of a block of ice. That's where it came from, unfreezing the ice, making the change and refreezing it into a new shape. So skipping forward on the slide to General Electric, this is in 2000. General Electric developed a process with about 7 steps. So we went from 3 to 7. The first few are kind of like unfreezing and then change. So there's leading change, which has to do with leadership commitment. There's creating a shared need. So convincing as many people as possible that this change needs to happen. There's shaping a vision, which is leadership articulating the vision clearly and in observable, measurable terms. And number 4 is mobilizing commitment, beginning the rollout and finding and leveraging early adopters. So that's sort of unfreezing things and working on the change. And then the following 5, 6, and 7 are about making that change last. 5 is called making that change last. 6 is monitoring the processes about the change. And 7 is changing systems and structures. So I'm not going to go through into detail about the others, Kotter's 8-step change, Jick's 10-step change model. But as you can see, they move from more simple steps that we saw in Lewin, unfreezing, change, refreezing, to some very complex models. But regardless, I think you can safely say that they are really all about preparing for change, number 1, making the change, number 2, and institutionalizing the change, number 3. These are really just many pathways to those steps. And if you think about it, not really that dissimilar from change in an individual. Next slide. Okay, so now I'll go into a little bit more detail on the ADKAR model itself. As you can see on this slide, this was, the ADKAR model was developed a couple decades ago by a Bell Labs engineer doing what engineers do, asking questions and trying to come up with a better framework. The engineer, Jeff Hyatt, founded ProSci, which is a company that uses this ADKAR framework as one of the foundational models in their methodology. So that's why you hear ADKAR and ProSci together a lot of times. The acronym ADKAR, and you'll see this in many of the next slides, stands for awareness, desire, knowledge, ability, and reinforcement. And those steps, and they are sequential steps, can really be divided into 3 stages. The current stage, which is the A and D, awareness and desire. The transition stage, which is the next 2, knowledge and ability. And future, which is reinforcement. Really a lot like Llewellyn's ice shape changing idea, right? Unfreezing, change, refreezing. And we're going to talk more about those steps in ADKAR, but again, the goals are similar. Approach change systematically. Number 2, increase the likelihood that changes are implemented as desired. And number 3, increasing the likelihood that the change is institutionalized. Okay. Next slide. So here are the stages in more detail of ADKAR. This slide and the next are included to illustrate that link between the ADKAR model or method of organizational change and the individual change using a model that I bet most of us, if not all of us, are really familiar with, the trans-theoretical model of behavior change. More on the next slide about that, but before we switch, just take a look. Awareness is the need for change, awareness of the need for change. Desire to make the change happen. Knowledge is the how. Ability is ability to implement, and reinforcement is how do you retain it. Okay, next slide. So as I was mentioning, this is kind of the link to the trans-theoretical model of behavior change. If we look at these 5 steps, you can see how neatly they align with those from Prochaska, DiClemente, and Norcross. I know that when I was learning ADKAR Framework, and I was in a class from ProSci that was teaching us, it just kept ringing a bell for me, and I couldn't quite place what I was trying to link it to in my head, and realized that it was this trans-theoretical model for individual change. And once I was able to sort of anchor that in my head, I was able to fix the content of ADKAR in a way that made sense to me as a clinical psychologist. And it helps me when thinking about organizational change and the differences in that work versus individual change work. Okay, next slide. So let's walk through that shift from individual to organizational change and understand why organizational change can sometimes be more difficult even than individual change. And I was thinking a lot about this, and I really do think that's often due to the distance from the individuals. So typically, the level that we work with in clinical psychology is at the level of the individual. But when you work at the level of the organization, you're removed from those individuals. Now you're sort of working with the collective, and it's mushier and a little bit more difficult. And some of the reasons I think are pretty well articulated in this description. So if you look at the first bullet, the impetus for organizational change often, if not always, comes from either outside the organization or from the top down to the workers. So it's sort of a top-down piece or outside push piece versus the impetus for individual change, which ultimately, and granted, sometimes there are outside pushes for individual change, but in order for the change to actually work, it really does ultimately come from a decision by the individual themselves. The second piece is level of control. So the level of control for change in organizations typically lies within management or upper management. So if you're going to make change happen, you can have it in organizations from the ground up, But it isn't until management or upper management agrees that it becomes widespread and institutionalized. Whereas the level of control for individuals is ultimately, again, up to the individual. And then the third part is the consequences. Consequences for individuals not changing within an organization really is limited to their work life. It's limited to their interface in the organization. You could get a poor review. You could lose your job. Not that that's a small thing, but consequences for individuals not changing a personal behavior is often much broader. So relationship loss or problems, health loss or problems, job loss or problems, or all of the above. So in the next few slides, we're going to go into more depth on each of those 5 steps we talked about and the related 3 changes. But I want you to kind of keep in mind this difference, right? Shifting from individual to organizational change, and think about tying that organizational change notion to the individual change steps that you know. Next slide. So we're at the A block. So this is the awareness, building awareness. And that lines up with the pre-contemplation stage when we're thinking about individuals. I'm going to run through some of the current state on this, some of the steps on this slide, and you'll see that the other slides are developed similarly so that you know where things are. So first of all, at the top, on the left of the colon is the ADKAR piece, building awareness. On the right of the colon is the individual change piece, pre-contemplation. Then we have what if we're in the current state, transition state, or future state in that step. With awareness, we're in the current state. Then we have various aspects underneath that. And then to draw your attention over to the little alphabet block, under each alphabet block are some of those change management activities that help you think about what would happen during building awareness within organizational change, for example. What would happen in that particular step? What are those activities? So when thinking about building awareness, number 1 says view of the current state. Really, this is the moving from if it ain't broke, don't fix it, to a finally we need an improvement sort of mindset, right? The second piece is really how the problem is perceived. Is there an adaptive cognitive style that's focused on internal challenges or threats? Or is there an innovative cognitive style that's focused on external challenges or threats? And what do we need to consider about both styles when we're working for change? And remember that with organizational change, a lot of this is getting buy-in, just like you do with individual change, helping identify a goal, getting buy-in, working up to the motivation to change, making the change, and sustaining it. And a lot of that in organizations depends upon the next 3 pieces. Credibility of the sender, right? So messages about the why we need to change really does need to come from the top, from the very top. And messages about how, like the pragmatics of that change, really needs to come from more immediate supervisors. When you think about a large organization like VA, that's what you see when there are shifts, right? You see messages from the secretary, something from the very top. The specifics of it tend to come from local supervisors or facilities, just the more immediate supervision piece. Then circulation of misinformation. This is an interesting piece because it's really a risk. It's not something that you're trying to do. And it's a risk based upon the timing of the notification of change. So if you think about it in your life at work, if you hear rumors, oh, there's going to be this big change coming, we're going to do X, Y, and Z in VA, I heard about it somewhere. And then you hear rumblings for a while, but nothing specific, right? The notification's delayed, something like that. What happens next? Rumors start, misinformation starts, guesses start. So this is a timing piece. You want to minimize the circulation of misinformation by ensuring that the timing on the notification of change is close to the details about that and the steps that people can take. And again, this is all about building awareness, the pre-contemplation stage. And the last piece is the contestability of the reasons for change. So often there are the internal drivers of change, or things you can't really observe, forces that are pushing for change, can increase the feeling that the reasons for change are debatable and become a barrier. So knowing your audience, understanding what pushes them, that's another piece. Thinking about the pushback against change. Okay, so next slide, we'll move from awareness, the A block, to the D block. So I'm not going to go through all of the steps on this one, but you can see it's the same setup. Creating desire aligns with contemplation on individual stages of change. And we're still in that current state. Remember, we have 3, current, transitional, and future. And there's a number of steps in this as well. What's the nature of the change? How does the organization or environment, what's the context for it? What's your personal situation? What are the intrinsic motivators? So again, moving through that stage, thinking about how that aligns with the contemplation stage of change for individuals. You're looking to build momentum here. Next slide. Now we're moving on to K, developing knowledge. And this aligns with the preparation stage when we're talking about individuals. And we've shifted from that current state to the transition state. So remember, the current state was awareness and desire, and the transition state is knowledge that we're on now and action that we'll be moving to in a minute. Again, thinking about developing knowledge is like the preparation stage for behavior change. What is the knowledge base? How can we get more knowledge? What resources are needed? So you're really geared up now to start the action, to make the change. Next slide. And this is the change. So the second part of the transition state, fostering ability or taking action, if we're thinking about Francesca and Clemente Norcross. You'll see these steps related to ADKAR are the psychological blocks that get in the way of action, physical abilities that you need to take the action, or intellectual capabilities that you need to take the action, that the organization needs to take the action. The time available to develop those skills, that's another piece. If it's a big enough change, you may need to develop new skills. And what resources there are to support the development of those new abilities. And all of this aligns, and I've noticed myself even in this slide switching back and forth between ability and action. That's how closely they align, particularly in this stage when we're thinking about individual change. Next slide. And then we're on the final building block for ADKAR, reinforcing change. And we've moved now to the future state. This is for both organizational and behavior change. Maintenance is the future state there as well. And this is all about refreezing that ice in its new form. So is the reinforcement meaningful to make sure that the change sticks around? Do people see it as progress or accomplishments? Are there negative consequences that are removed? And what's the accountability for the system to reinforce that change? So this is how do you make it last? Next slide. Okay. We've gone through the A, the D, the K, the A, and the R for ADKAR. And this piece provides a little bit more depth about those stages. On the left side, on the orange part, you can see who's needed to sponsor each of those stages, which is who the key players are. So when you're thinking about, in the beginning stages, you're thinking about awareness, and you're thinking about creating desire. You need leaders as primary sponsors. You need leadership coalitions for that. You also need managers and supervisors for that. You'll notice that managers and supervisors are necessary key people throughout the entire ADKAR process, but the involvement of leadership kind of shifts after you transition from that initial awareness piece, the building awareness, creating desire. Once we move into knowledge, this is really about managers and supervisors, and then into action, we're thinking about managers and HR as well, and project team people that are moving it along. And then finally, when we get to reinforcing, we're back to leaders and management again. So that's the piece on the left, who the key players are and how that kind of maps onto, if you look on the right, those change stages, the phases of change. And then the important part, how the results are assessed in each one. So I really do think that this slide illustrates one of the main reasons that ADKAR is so popular. It's systematic and it's measurable at each step. So if you look at the awareness phase, employee feedback will let you know how well you're doing with awareness. With knowledge, training feedback can let you know. Reinforcement, audits and compliance can let you know. So there's a way to see where you are in each stage. And that's, I think, really very helpful. Okay, next slide. That said, like any process, there are things that help it along and things that get in the way. And this slide shows those aspects, including how important active leadership support, good communication, and structured work are to the success of any organizational change. So now I'm going to turn this over to my colleague, Dr. Schmitz, who will take you through an example of how the ADKAR process can be used for change in a healthcare facility. So this will help concretize all of the more abstract pieces that we've been talking about. But keep in mind, as she goes through this work, this isn't intended to reflect any particular facility, but really an amalgam of change work that's been seen in many many facilities throughout VHA. Dr. Schmitz?
Thank you, Dr. Hunt. So as Dr. Hunt nicely provided an overview of ADKAR, we are actually going to take each of those ADKAR steps and think about how they apply to organizational change while also paralleling what that may look like at the individual level. Because certainly within organizations, we have individuals. We would not have an organization without those individuals who comprise it. And so when we think about ADKAR implementation, it is really important to have a thorough understanding of the starting point or context within which the change will occur. This might even be thought of as pre-contemplation, if you will. So as we're thinking about using ADKAR as a framework, we really need to be aware of what our context is for that change. Just like in a therapeutic context, understanding the baseline as well as the therapeutic goals, or in the case of the organization, the desired organizational achievements, these are necessary to be able to create effective change and ultimately sustain it. So for context then, today's implementation example focuses on a large, two-campus, very complex healthcare system that is trying to improve upon their integration of primary care and mental health. Of note, this two-campus location has one campus in a very urban area, and their second campus is about 45 minutes away in a more rural area. And so when we think about the implementation of change within this example, the change process has to work at a campus that is well-resourced, well-connected, accessible, and at a campus that is a little less accessible and perhaps not as well connected to, say, other institutional supports or training programs. So when we think about implementing change at this large two-campus complex healthcare system and what their goals are, they really hope to improve upon the integrated care aspect of their continuum of care to assure more consistent access to mental health care. They also hoped to develop and implement a more consistent process for discharging patients back to primary care once they've completed a course of mental health treatment. In short, they want to assure consistent access in an ongoing way to both time-limited integrated care, more complex mental health care, and to primary care services. all while supporting their staff in both mental health and primary care. So, a pretty easy change, all things considered. This care location, and as we think about context, also experienced some significant changes in leadership in the 18-month period prior to deciding to implement this change. These leadership changes occurred at the facility and programmatic leadership levels and created some unique challenges with buy-in. As you heard Dr. Hunt mention, buy-in and I really like the phrase used, the contestability of the reasons and the buy-in related to those. That piece will be very important, and some of these changes then created some unique challenges around those areas. These changes in leadership also simultaneously created opportunities to leverage the new relationships and more easily shift away from existing patterns, some of which were driven by specific individuals and were designed to benefit those individuals, their specific preferences, or their individual programs. And so in thinking about the first two pieces of ADKAR, awareness, desire, and then their parallels in the individual levels, pre-contemplation and contemplation, remember this is that first sort of unfreezing piece, as Dr. Hunt reviewed. And so the problem identification and perception is a significant piece of where the work exists at this beginning part of the ADKAR change management process. So in thinking about problem identification, as I alluded to earlier, the overarching goal for this facility was to better integrate their mental or behavioral health service with their primary care services. The ultimate goal is to improve care across that entire continuum. However, the actual problem was assuring that the definition of improvement, specifically well-integrated care that assures those smooth care transitions bidirectionally between primary care and mental health, that piece was appealing to both services and was embraced by all stakeholders. This means that the goal of awareness raising was to assure that the perception of need existed in all parties and that it aligned. At this facility, performance measurement was also not terribly well understood across programs, as each specialty area prioritized different goals. And so when we think about measuring those outcomes at this awareness and desire level, we weren't even really comparing apples to apples as a starting place to think about what change might be needed to get to those identified goals that improved access to care across the continuum. Additionally, as with individual behavior change, the organizational change task at the desire contemplation stage centered on assuring that the measurement of progress was not only understood, but was valuable to all parties, while assuring that that future state was seen as more appealing than the current state. And as you heard me mention earlier, within this context of leadership changes, that current state might have actually been more appealing to some, right? When we think about our individual change, sometimes the unknown is a little unsettling. And so current state might be more familiar or more appealing. And so the awareness raising and supportive desire to change here is really making sure that we're all on the same page, and that same page leads to a future state we can all get behind. Unlike individual change, where the goal is exceptionally salient to the person making changes, sometimes that future state is not as meaningful to the individuals who work within the organization as it is to the organizational leaders. As Dr. Hunt mentioned, when we think about organizational change, we are inherently moving away from individuals. So this is an area where significant investment in shared goal setting and consensus building is very important. And in fact, at this facility, the bulk of the work was on this front end, these first two steps. Similarly, individual outcomes are frequently easy to identify by the individual involved in that therapeutic endeavor. Organizational change is inherently more complicated, as the goals may be easy to identify within groups, say within mental health or within primary care or within a leadership view of the problem, and they are typically a bit more challenging to align. And so when we think about the next two pieces, that more active state, knowledge or preparation at the individual level, and ability or action, as we think of these two pieces, and we're thinking from the context of effective consensus building, this facility consulted with a number of change management and subject matter experts that helped assure that the awareness raising and the education piece were supported beyond the folks who were immediately asked to make changes. So there's a lot of different viewpoints on this change process. And with these experts as consultants, they have the opportunity to be a little bit removed from the immediacy of ego or past history and really allow the change process to be driven by their expertise and their knowledge of effective process and really great outcomes. And so together with these experts, they were national level leaders in primary care and mental health and integrated care. The stakeholders at the facility began by critically examining their current state. And as you heard me mention in the previous slide, this piece, the early consensus building and then the awareness raising, took a lot of the bulk of the change effort investment early on. And one exercise that we used with this site to help build perspective was to have each service attempt to describe the current state processes of the other service in order to determine how well each service understood the current state or the current workings of the other service. So mental health was asked to describe how it worked to get a patient in the door, connected to care, and through a course of treatment for primary care, and then primary care was asked to do the same for mental health. This was very enlightening for both groups. We also separately had leaders from each of the groups and from the facility engage in this conversation to see, not test them in the moment in front of their staff, but to really get an understanding of how well they may be aware of the gaps. And so very enlightening for all involved. While this exercise may not be terribly unlike diving deep within individual therapy, the collaborative cross-team examination that these groups undertook allowed in-the-moment collateral reporting and shared perspective analyses that may not always be available during individual therapeutic interactions. So we might not have that secondary reporter who we can get information from or reactions from in the moment in that individual action, but we have that as built-in part of organizational. The examination of current and future states also quickly identified psychological blocks at the individual, group, and organizational levels, along with identification of resource gaps that were both conceptual and physical. So within the organization, as you heard Dr. Hunt mention earlier, that level of control or locus of control for addressing the blocks and addressing limitations that often exists at a level beyond the individual. This underscores again the need for buy-in that we discussed at that awareness raising step. The other piece, as we think about that grid with where leaders versus middle level supervisors, where they are more active, the buy-in piece and the activation to address these gaps and these barriers, that has to happen at the higher levels so that our frontline staff and those folks making the change happen within the context of their practices and their procedures, they have to feel supported and like leadership has their back. And so without buy-in, it will be nearly impossible to address the identified barriers, as motivation to do so from our frontline folks might be inherently lacking. So the subject matter experts also provided significant consultation and education throughout the process. I jumped ahead a little, so just want to touch on this, and then we'll talk on this last stage of the R. But when the folks were involved in that review, see now I'm just clicking all over the place here. Pardon that extra click. The subject matter experts really took a significant opportunity to weigh in when those gaps were identified. So as you heard me mention, leadership buy-in and support is integral, but the subject matter experts also provided input in ways that help stakeholders at all levels feel understood. And this allowed them to more effectively align at the service, program, and leadership levels their goal-driven efforts with outcomes. And as a result, they were able to make significant changes in processes in a very short amount of time. Organizationally, this is measured in our outcomes, such as our performance measures and other important pieces we'll touch on in the next slide. And this is not unlike the tipping point or insight achievements achieved at the individual therapeutic engagement levels that lead to rapid growth between sessions. Now we'll move ahead to that next slide. And so now we're at that final piece, the R of ADKAR, or the maintenance phase, when we think about investment in change and then how we sustain it. So with any behavioral change, the initial achievement of meaningful new processes is as valued and valuable as the benefits of ongoing growth and sustainment. So one can't really happen without the other. We cannot support ongoing growth without recognizing the positive impact of those initial achievements, because at the facility level especially, these initial successes are hoped to be additive and inspire ongoing growth. And so we must celebrate those. We must give them positive recognition. And reinforcement at the facility, this facility in particular, came in the form of rapid improvement on those crucial performance measures, such as more consistent access to same-day mental health services, more rapid specialty mental health engagement, increases in stakeholder and customer satisfaction, so our frontline staff and those who receive services, and more consistent processes for discharging patients who've completed a course of treatment. This piece really served to free up space in both mental health and primary care. And I have to say that was to the surprise of both services. The providers were rewarded and praised for their efforts by facility and catchment area leaders. So the recognition for the achievements of this facility and this change management process were recognized at multiple levels. Upon seeing the beneficial impact of these improvements within mental health and primary care and how they led to greater ripple effects in stakeholder and customer satisfaction, the higher level leaders at this facility invested further in the improved processes by approving additional staff to be hired, not just for mental health, but also for primary care. So this was really beneficial because it served to benefit both services rather than one service benefiting potentially at the expense of the other, and served to improve collaboration between the services. Both service leaders and frontline staff within these services felt like their collective needs were recognized, were supported, were valued, and they were able to then be celebrated by getting more staff, not just to add to this really great system that they had built, this new process, but also so that they could potentially grow in other areas. Leadership really responded so positively that this also created some innovation, and this site, beyond this specific application of ADKAR, engaged in some really great innovative thinking that served the organization as a whole. Change at the system level is sustained in the same way as it is at the individual, by engaging in regular review of progress and assessing ongoing goodness of fit relative to the identified goals. Unlike individual therapy, where the perspective of only one customer or stakeholder is prioritized, accountability and sustainment at the systems level requires additional clarification and coordination. So specifically, ongoing messaging about those identified goals, their value, and the relevance of the goal state to multiple stakeholders is necessary. And as we think about sustainment, having that celebration happen widely as well helps support that ongoing messaging. Assessing the aspects in an ongoing way also allows for proactive adjustment in future planning. This may not automatically or naturally happen in a system that is inexperienced in these processes or is early in the change management activity. But in this way, when we think about that proactive future planning and how it might become a more automatic process, the habit of reinforcing change itself becomes this new process or this new state. And that has application and resonance at both the individual and systems level. And so as you heard me allude, one of the most important pieces is really celebrating successes. So not just reinforcing or rewarding, but celebrating those successes at multiple levels. So the change management process at this facility continues to be celebrated, not just at the facility and within the program areas, but at the catchment level as well. This particular facility went from one that was lowest performing in the region to one of the best. And as we alluded to earlier, this is a combination of factors. So, as we think about how this might apply, we wouldn't say, oh, you need to go to speak to facility X or facility Y. But we really want you to be thoughtful about how does change and the change management process parallel that individual process, and what can we take from our skills as individual clinicians and apply to the change management efforts at our organizational level. So organizational change often follows that parallel process to clinical, therapeutic, individual change. I would say that the greatest difference is in terms of who is the identified patient and the meaning-making processes at each step in the change management framework. And so we really appreciate your time and attention today. We welcome your questions, and I invite my colleague, Dr. Hunt, to jump in if there's anything else she'd like to add now. And I think I see at least one question in the chat box. So we'll also defer to Dr. Spinola in the event that there's some additional business before we get to questions.
Thanks, Theresa. I don't have anything to add. I appreciate your examples.
Awesome. Thank you, Marcia. Dr. Spinola, do you want to handle the Q&A?
Yes.
Oh, I see.
So, yep. So I can go ahead and answer this because it's will the slides be available? And yes, they will be posted to our webinar webpage in the next few days.
Perfect. And as an aside, there are a lot of folks who have wonderful skill in ADKAR change management practices and procedures within our organization, and certainly within Division 18. Dr. Hunt and I are folks who have that skill set. And certainly if you have questions, we encourage you to reach out to us, but we may also be then able to connect with other folks who have that expertise as well.
Okay. So thank you so much, Dr. Hunt and Dr. Schmitz. I want to also thank everyone for being here with us today. And I don't know if there are any questions. I'm still manning the Q&A. Oh, okay. So we do have a question. Do you see the application of this model with DEI work?
I would say anytime you're working at a systems change level for an organization, you could apply this model, whether it's trying to change approaches to things or change people's minds. That all kind of goes hand in hand. So I would say yes. Dr. Schmitz?
I wholeheartedly concur. And in fact, when we think about meaning making and understanding the context at that very beginning of the ADKAR process, so awareness, I think that the ADKAR framework might actually serve as a really great frame with which to approach change within the realm of DEI. And perhaps, like the example undertaken at this facility, helping folks look at different perspectives, walking through what it might be, where the gaps might be or where there might be opportunities, might be really awareness raising for folks who might not otherwise be thinking of opportunities in the same way. So absolutely.
Yeah, and as you were talking, I'm thinking too, as working through something systemically or systematically like this can help you see within the system where various stuck points are. And that's kind of the advantage, I think, of this kind of framework. Yeah, I was reading this next question, sorry.
You're fine, I was too. I agree with you completely though. I think having it be an identified framework of approach might also make change that much more approachable because it doesn't fall on any one person to make those changes. And those stuck points or gaps can be made more visible by the group process, much like group therapy, if you will, as opposed to an individual feeling like they have to be the sole change practitioner, change manager, or the sole change identifier.
Good point. And I may have just, yeah, I just bumped it to answered. I put a couple of the references that are on the last slide. If Theresa, you want to go one more slide, I think you can see those references. There are a couple of books by Hyatt, who developed the ADKAR model there, and other pieces that we have included throughout the slides, references that we've included there. So hopefully those will be helpful for resources for you.
And thanks for reminding me we had one more slide.
All right, are there any additional questions? Oh, so we got to thank you so much. And I know in the chat, someone already wrote what a wonderful presentation this was.
Wonderful. Thank you for your attention. We really appreciate it.
Thank you so much. Oh, go ahead.
Oh, so I just wanted to thank you both again and thank everyone for joining us. And I did paste into the chat, if you are interested in receiving continuing education credit, please complete the survey by April 5th. And if these are free for Division 18 members, and if you are not a Division 18 member, then it is $15 if you're interested in continuing education credit for today's talk. So I think that that is it. If there's, I don't see any additional questions yet. And in the chat, that was very timely and applicable. And a lot of thank yous, I think. So, all right, so I think that that's it. Thank you again. We really appreciate you guys doing this for us.
Thanks for having us.
You bet. Thank you. Have a great day.